Hello everyone, welcome to the rationalization of our semis for Nloa 2, and I'm actually in charge of discussing E1 and E2 for Nursing Practice 5 on the care of clients with physiologic and psychosocial alterations part C. Let's begin with question number 1. Which of the following is the priority intervention to encourage a client who is depressed to discuss any suicidal plans, thoughts, or intent? A. Instruct the client about the consequences of hidden anger. B. Focus on the need to keep the client safe. C. Avoid discussion of depressing topics. Or D. Encourage the client to verbalize feelings. Of course, when we are going to eliminate options here, we know that a patient who is actually suicidal cannot actually follow instruction. Therefore, eliminate letter A. And then letter C, avoid discussion of depressing topics. It should be eliminated. Why? Because it's very important that we're going to talk to this patient because that is requiring safety issues. We're left with letter B and letter D. Focus on the need to keep the client safe or encourage the client to verbalize feelings. We know that if a client is actually depressed, our main priority is to establish therapeutic communication. Therefore, it's very important for us to establish verbalization of feelings. The correct answer for number 1 is letter D. Because, of course, this is the best time for the client to share his or her thoughts about contemplating suicide. And it's very important because that will allow the nurse to understand what the client's emotion is and the client's mood as well. The correct answer for number 1 is letter D. Encourage the client to verbalize feelings. Let's have question number 2. When assessing a client in the emergency room after an attempted suicide, the priority question the nurse should ask the client is which of the following? A. What is happening in your life that would cause you to attempt to kill yourself? Letter B. How are you feeling since you have awakened after your overdose? Or letter C. Where is the pill bottle of the medications that you have taken? Or letter D. What can be done to make your life better? Of course, we know that asking the client how he or she is feeling after the overdose, and at the same time where the pill bottle is and what can be done to make the life better, are considered to be appropriate intervention. But our priority is to ask the client what has led to the attempted suicide. And this is actually very important because this gets at the heart of the matter, which is focused on the suicide attempt and encourages the building of the nurse-patient relationship. And this encouragement will allow the client to further express personal thoughts and feelings because there is already establishment of rapport. The correct answer for number 2, alpha. 3. The priority intervention for an outpatient nurse is to perform for a client who is depressed and has told the nurse that I'm worthless and there is nothing to live for would be A. Immediately seek psychiatric hospitalization for the client. B. Explore feelings of worthlessness and hopelessness. C. Encourage the client to identify self-deprecating thoughts. D. Remove all potentially dangerous objects from the immediate area. Of course, eliminate immediately letter D because of the word absolute, because of the word all. Sorry, and then it's also very important that we're going to eliminate letter A. Immediately seek psychiatric hospitalization for the client. That's also absolute. The correct answer for number 3 is letter B. Explore feelings of worthlessness and hopelessness. Although it's important to encourage a client to identify self-defeating thoughts, it is not the most appropriate intervention in the outpatient setting because that has no admission yet. And while exploring the client's feelings of worthlessness and hopelessness, the nurse can assist the client in exploring a sense of worth, value, and hope. And of course, there are numerous clients living in the community who are chronically suicidal and can be managed on an outpatient basis. And of course, as what I mentioned earlier, removing all potential dangerous objects from the immediate area and seeking immediate psychiatric hospitalization are considered to be premature. So what we're going to do now is explore. Number 3, letter B. Number 4. The nurse who is caring for a client who is manic and exhibiting psychomotor agitation implements which of the following intervention as the priority? A. Explore alternative behaviors with the client to use when helping or when feeling anxious or hyperactive. B. Provide limits for the client when allowing the client space. C. Explore stressors that precipitate manic behavior. Or D. Assist the client in identifying negative consequences of behavior. The answer here is letter B. Because we know that the client who is manic and exhibiting the clinical manifestation of psychomotor agitation is only minimally able to have insight into those others or ways to change the behavior. And this requires limits within provided structure and space. So letter A, explore alternate behavior. That's also wrong. Explore stressors that precipitate manic behavior. That's also wrong. And assist the client in identifying negative consequences of behavior is also wrong. What are going to do is to provide limit settings for letter B. Number 5. When completing an admission assessment on a client with schizoaffective disorder, the nurse should assess for the presence of each of the following clinical manifestations. 1. Increased use of substances. 2. Decreased libido. 3. Hallucinations. 4. Feelings of entitlement. 5. Decreased energy. And 6. Anhedonia. Of course, in this case, we know that schizoaffective disorder is characterized by elements of schizophrenia and manic depressive disorder, and that includes presence of hallucinations. At the same time, there is a decrease in energy and anhedonia, because we know that anhedonia is lack of interest in pleasure or daily activities. Therefore, there is no substance use, there is no decreased libido, and there's no feelings of entitlement, because that is specific for manic. In this case, the correct answer is 356, and that is letter D. Number 5, D. Number 6. A client diagnosed with bipolar disorder and who has a superimposed seasonal affective depression is using phototherapy as a treatment to lift the depression. The client calls a nurse at the outpatient mental health clinic reporting my mood, libido, and interest in shopping have improved dramatically. Based on this information, which of the following is the priority to assess first? A. Explore energy level and level of appetite. C. Ascertain how much money the client is spending. B. Ascertain how much money the client is spending. C. Identify the time of the day the client is utilizing the phototherapy treatment. Or D. Encourage the client to explore thoughts of improved self-worth. The correct answer for number 6 here is letter C. So we know that the client with bipolar disorder and superimposed seasonal affective depression needs to be careful about the time of the day that the phototherapy is utilized, because we know that circadian rhythm, and it has been found that bipolar clients with seasonal depression do best if they utilize the phototherapy treatment later in the afternoon. And if the phototherapy is used in the morning, manifestations may result. And exploring the appetite, energy level, feelings of self-worth, and how much money the client is spending may all be important interventions, but determining the time of the day the client is using the phototherapy allows a nurse to obtain the information that may cause the dramatic change and elevation in mood. So number 6, the best answer is letter C. Let's proceed now to question number 7. The discharge plans are being made for a client hospitalized for depression. Which of the following is a priority outcome for a diagnosis of depression? A. Share more realistic expectations of the client and the situation. B. Identify negative, unrealistic thoughts about oneself and ways to counteract those thoughts. C. Discuss reasons why the client has turned the anger inward. Or D. Openly express thoughts and feelings of depression. Of course, the correct answer here is letter D, because there is a feeling of openness of expression of the ideas. So we know the priority outcome for a client with depression would be to openly express thoughts and feelings of depression. Although that's not the priority, it may prove beneficial to share a more realistic expectation of the client, and this will also help the client identify negative and unrealistic thought about him or herself and discuss reasons why the client has turned the anger inward. 7. The correct answer is letter D. 8. The nurse receives a report on a client with dysthymia or dysthymia. It would be most important for the nurse to make which of the following assessments? 1. Chronic feelings of low self-esteem. 2. Poor concentration. 3. Flight of ideas. C. Hallucinations. D. Depressed mood. And number 5 is the depressed mood. Number 6 is increased libido. So is it A, 1, 2, 3, 4, 5, 6, B, 1 to 5, C, 1, 3, 4, 5, or D, 1, 2, 4, 5? So of course we know that dysthymia or dysthymia is a chronic depressive disorder lasting for several years. And the clinical manifestations of dysthymia includes feelings of low self-esteem. Therefore, number 1 is correct. Eliminate. We cannot eliminate an option yet. Number 2, that is poor concentration. So number 2 is actually correct. Eliminate choice letter C. And at the same time, there is presence of depressed mood. So number 5 is correct. So 1, 2, 5 is the correct answer for number 8. That's letter B. Because we know that flight of ideas and increased libido are clinical manifestations found in the manic phase of a bipolar affective disorder, and presence of hallucination is present for patients having schizoaffective disorder. Number 8, 1, 2, 5 only. Number 9. Which of the following interventions should the nurse implement when treating delusional thinking in a schizoaffective disorder? Number 1, instruct the client on socialization techniques. Number 2, identify difficult experiences and assist to decrease anxiety. Number 3, provide reality testing. 4, develop a regular schedule with the client. 5, set realistic goals. 6, encourage exercise. Correct answer here is letter D, 2, 3, 5. That is identify difficult experience, provide reality testing, and set realistic goals. So our nursing intervention here, especially for delusional thinking, is based on the clinical manifestations of schizoaffective disorder that includes, as what I mentioned, identify difficult experiences and assist to decrease anxiety, and provide reality testing and set realistic goals. Instructing the client on socialization technique is an intervention for patients having anhedonia and flat affect, and when you're encouraging exercise is an intervention for decreased energy, and developing a regular schedule with a client is an intervention in the treatment for difficulty making decisions. Number 9 is 2, 3, 5, and that is choice letter D. Number 10, the nurse assesses which of the following to be negative clinical manifestations in a client with schizoaffective disorder. Auditory hallucination. Number 2, anhedonia. 3, difficulty making decisions. 4, delusional thinking. 5, decreased ability in carrying on a conversation. Or 6, tactile hallucinations. Of course, we know that negative clinical manifestations for patients with schizoaffective disorder includes anhedonia. Therefore, correct number 2. Difficulty making decisions. Correct number 3. And a decreased ability in carrying on a conversation. That is number 5. The correct answer for number 10 is 2, 3, 5. And of course, we know that auditory hallucinations, tactile hallucinations, and delusional thinking are part of the positive symptoms of schizoaffective disorder. Number 10, the correct answer is letter B. 11. The nurse is caring for a client who is in a manic state of bipolar disorder. Which of the following should the nurse prioritize as the most appropriate nursing outcome? A. The client will be free of agitation, hyperactivity, and restless behavior. B. The client will appropriately verbalize feelings of anger. C. The client will be free of aggression and threatened behavior towards others. Or letter D. The client will demonstrate lesson buying sprees and grandiosity. The correct answer is letter C. And Our priority is basically letter C, in order to make sure that the client will be free from aggression and threatened behavior towards others. And that is making sure that you are also promoting safety. 11, the correct answer is letter C. Letter A is wrong because you cannot actually predict free of agitation. Letter B is also wrong because verbalization here is not a priority because the client is actually manic. And letter D, the client will demonstrate less in buying sprees and religiosity. That is actually not our priority for patient selling mania. 11, the answer is C. Let's proceed to question number 12. Which of the following clinical manifestations of schizoaffective disorder should a nurse assess the client for? 1. Flat affect. 2. Hallucinations. 3. Decreased activity. 4. Delusional thinking. 5. Anhedonia. 6. Anorexia. Number 1, which is flat affect, is actually correct. Because we know that schizoaffective disorder is a disorder characterized by major depression, manic, or mixed episode that coincides with diagnosis of schizophrenia. And the manifestations include must not be the result of medical condition or abuse. And the main clinical manifestation includes flat affect, decreased energy, and anhedonia. And that is 1, 3, 4. 12. The correct answer is C, 1, 3, 4. That's it for part E1. Let's proceed now to part E2. And that is care of clients with personality disorder. 13. At what stage of life does the nurse anticipate the clinical manifestations of personality disorder to become evident in the client's behavior and actions? Is it childhood, adolescent, and early adult, middle age, or old age? Of course, we know that this personality disorder is actually going to have its onset during adolescent or early adulthood, because we know that personalities are formed during childhood. Therefore, dysfunctional pathology will not appear until the client's personalities have been tested by the trials of life, and these life events begin in adolescence or early adulthood. The correct answer for 13 is letter B. 14. The nurse should include the following interventions in the plan of care for a client with dependent personality disorder. Limit the client's opportunity to make decisions. Ask the client's family to make important decisions for the client. Acknowledge the client's situation with empathy while encouraging independence, or withhold feedback regarding the client's situation until the client has made a decision. The correct answer is C. With the client's dependent personality disorder, feel inadequate to make decisions for themselves. By acknowledging their difficulties, confidence is built. In turn, the confidence will facilitate independence from the care providers and others they may be dependent on. 14, letter C. Let's proceed to question 15. The nurse assesses a client suspected of having histrionic personality disorder for each of the following behavior: dissatisfaction associated with being in the group, concern about appearance, idealizes the nurse and then devalues the nurse, verbalizations of grand things done or planned, compliment-seeking behavior, or has rapid shifts of emotion. The correct answer for 15 is 256, and that is letter D. Although the person with histrionic personality disorder seeks attention and craves novelty, stimulation, and excitement, the satisfaction for this person comes from attention given by others, not from within the self. In the dialect of first valuing and then devaluing the nurse is indicative of borderline personality disorder, and people with histrionic personality disorder seek out groups or other people to validate themselves. Correct answer, Delta, 256 only. Let's proceed to question number 16. Which of the following should a nurse include when planning to provide education to a client with schizoid personality disorder? Is it provide education in a large group setting to encourage socialization? B. Deliver education individually in a clear and concise manner? C. Present the information in a theoretical format? Or D. Engage the client in a therapeutic relationship before providing education? Of course, the correct answer here is letter B. Of course, we know that the client with schizoid personality disorder is technically minded, So attempting to draw the client into a personal or therapeutic relationship or to participate in a group or social getting may push a client to withdraw and become isolated. 16. The correct answer is letter B. Let's proceed to question number 17. The nurse concludes which of the following to be characteristics of personality disorders? 1 is unstable over time, 2 leads to distress or impairment in functioning, 3 is adaptive in interpersonal context, 4 has insight into self-behavior, 5 distresses those close to them, 6 onset in adolescent. So correct answer here is letter D, 256. That is leads to distress, distresses those close to them, and onset is in adolescent. Of course, we know that personality traits include an early onset in adolescence and leads to distress or impairment in functioning and distress those close to them. Because personality disorders are maladaptive, especially in interpersonal contexts, clients lack insight into self-behavior and the disorder is stable over time. 17. Delta. Question number 18. Which of the following character assessment would provide the nurse with the most accurate information regarding a low serotonin level in a client with personality disorder? Psychosis and hallucinations, delusions and paranoia, depression and impulsiveness, or restlessness and agitation. Of course, we know that serotonin is believed to maintain good stability and control impulsivity, including rage, aggression, and depressive clinical manifestations. So, delusions result from a faulty thought structure and are related to thought disturbances such as paranoia and grandiose beliefs. And restlessness and agitation are symptomatic or increased serotonin levels. 18. The correct answer is letter C. Question number 19. During an initial interview with a client who has personality disorder, the nurse evaluates which of the following to be present in a client's personality traits: changes in the personality that have come about because of stressful event, personality traits that are beyond the range found in most people, or personality traits that have changed with advanced age, or changes in personality that differ to fit the situation. So the correct answer here is letter B, because personality characteristics are formed in childhood to early teens, and the characteristics are set and stable over time, and events and situations may make characteristics more apparent, but these characteristics do not change, and changes in personality in advanced age are potentially related to a medical condition. The prolonged stability of personality structure makes treating personality disorder difficult and a long process. 19 is Bravo. 20. The nurse is caring for a client with schizoid personality disorder. In determining what the plan of care should consist of, which of the following should the nurse consider? The client quickly becomes attached to the group leader, displays behavior lacking social tact or grace the group, or becomes overly emotional in the group setting, or attempts to build intimate relationships with other group members. 20. The correct answer here is B, because individuals with schizoid personality disorder have difficulty showing and sharing their emotions, and they lack desire to be part of the group or have intimacy in the relationship, and this leads to inappropriate behaviors in lack of social tact and grace in a group or social setting. 20. Bravo. 21. The nurse evaluates a client with schizoid personality disorder to exhibit which of the following behaviors? 1. Irresponsibility with intentional deceit of others. 2. Grandiosity and a lack of empathy for others. 3. Peculiar with exaggerated social anxiety. 4. Social isolation. 5. Restricted range of emotion. 6. Appears indifferent to praise. So the correct answer is letter C, 456. Because we know that irresponsibility and intentional deceit are descriptive of antisocial personality disorder, and grandiosity and lack of empathy are behaviors of narcissistic personality disorder. And a client with schizotypal personality disorder would have peculiar behaviors and show exaggerated social anxiety. And schizoid personality disorder behaviors are described as social isolation, There's restricted range of emotion and indifferent to praise. 21 is letter C. 22. The nurse suspects a narcissistic personality disorder in a client when which of the following clinical manifestations are present? Grandiosity, excessive need for nurturance and emotional support, right or rigid behavior, lacks empathy for others, arrogant, and lawful behavior. Answer here is 145. So that's letter B. Characteristics of narcissistic personality disorder include grandiosity, lacks of empathy or others for others, and there is arrogance. An excessive need for nurturance and emotional support is found in dependent personality disorder, and a characteristic of antisocial personality disorder is having an unlawful behavior. 22, the answer, bravo, 145. 23. Which of the following interventions should a nurse include in the plan of care for a client with schizoid personality disorder? Empathize with the situation and avoid validating the solutions or distortions. Promote trust by recognizing distortions. Use reality orientation whenever possible, or dispel the distortions by identifying their bizarre nature. The correct answer here is alpha. Because we know that schizoid personality disorder is a personality disorder characterized by a marked detachment from people and events, such as lack of close friends, spend most of their time alone, and show little emotions, empathizing with the client and not endorsing the distortions that validate the client is not appropriate approach, and this will allow the client to trust the nurse as the caregiver. And statements should be used that validate the client's response and feelings to distortions, such as I can see this is upsetting to you, and challenging the client's reality will push away the client and may elicit an aggressive behavior. 23, alpha. 24. The nurse is planning the care of client with borderline personality disorder based on which of the following basic behaviors? Chronic feelings of emptiness, unstable interpersonal relationship, suicidal gesture or mutilation, excessive attention to appearance, holding of grudges for long periods of time, and submissive behavior. The answer here is 1 to 3 only. Let's letter B. Suicidal gesture, self-mutilation, chronic feelings of emptiness, and unstable interpersonal relationships are behaviors found in persons with borderline personality disorder. The client with this chronic personality disorder will pay excessive attention to appearance, and a client with paranoid personality disorder will hold grudges for long periods of time, and submissive personality disorder, submissive behaviors are descriptive of dependent personality disorder. So number 24 is 1, 2, 3, and that is choice letter B. 25. The nurse is caring for a client who is using or who is seeing UFOs, and asks if the nurse is also afraid of the UFOs. Which of the following would be an appropriate response from the nurse? I don't know what you're talking about. I don't see any UFOs. B, I can't tell that what you are seeing frightens you. How can I help to make you more comfortable? Letter C, I see the UFOs too, and they scare me. What are we going to do? Or D, I don't see the UFOs. Are you ready to come to a group? So the correct answer here is letter B. Then the client who complains of seeing UFOs, that I can tell what you are seeing frightens you. How can I help to make you be more comfortable? This actually validates the client's feelings without agreeing with or challenging the client's irrational belief. Last, number 26. Based on the understanding of OCPD, which of the following should be considered before planning the care? The client is eager to become involved in the therapeutic relationship because there is a sense of aligned attachment. Letter B, the client is eager to tell personal stories and have others admire what has been accomplished in the past. See, the client views the therapeutic relationship as a waste of time because the client doesn't see a personal behavior problem. Or did the client may vacillate between wanting the therapeutic relationship and pushing it away depending on what the threat is seen. The correct answer here is C. Because the client with OCPD views a therapeutic relationship as a waste of time because personal behavior is not recognized as a problem. And a client with dependent personality disorder is eager to start any kind of relationship, such as client will go anywhere at any time for the sense of attachment and security. And a client eager to be admitted uh, falls into the category of narcissistic personality disorder, and the oscillation between wanting a relationship and then pushing it away is indicative of a borderline personality disorder. So the answer is C. And that is it. We're done with discussing the answer of semis for NP2. Thank you so much for listening. Congratulations to all.